Now, to the parents fighting for what many will see as a basic need, the right kind of toilet to change their disabled children.
We've been investigating how many of our region's main hospitals have what's called a changing places toilet. They're much bigger than a normal bathroom with specialist equipment like hoists.
Yet just over half of our region's hospitals still don't have them. It means many parents are forced to change their child on the floor, or worse, they're not changed at all. Rebecca Howarth has this exclusive report.
Going to the toilet is a basic human right, yet it's something 16-year-old Sienna is regularly denied. She's got cerebral palsy and is often at Peterborough City Hospital attending appointments, but it doesn't have a changing places toilet. Without this specialist facility, her mum Natalie is often forced to change her on the floor.
There's no dignity really, you know, there's not always somewhere that you can go. I can ask for a room to use, but there's not always a way to lift Sienna in and out. So if she does go to the toilet while we're there, she's sat in it. She could get home and her skin's broken down. It can be painful.
It's not just dignity that's at play here, it's also Natalie's own health. Sienna's 37 kilograms, and with no hoist, it's quite literally back-breaking work.
I actually had 2 prolapse discs from lifting Sienna through the years. I've had surgery myself on my spine. Yeah, it has a huge impact.
Michelle runs Little Miracles, a charity in Peterborough supporting families of children with additional needs. She's fought for a changing places toilet at the city's hospital for her 18-year-old son Oliver for years, but so far nothing's materialised.
It feels like we don't matter. At the hospital, for example, we would have to lift him out of his wheelchair and lay him on the floor, and sometimes the floors are filthy, they're wet, they're dirty, they're disgusting. It's not very dignified, and although he does have learning disabilities, he does understand what is happening.
Regular disabled toilets often aren't big enough for those with certain disabilities, which is why changing places toilets like this one at the Royal Papworth Hospital are so important. They're much larger and have specialist equipment. There's an adult-size changing bench along with a ceiling hoist which can lift up to 150 kilograms. And there's a peninsular toilet allowing carers access from either side. But what we found is not all of our region's main hospitals have these types of facilities. Out of the 11 hospitals that we contacted, just 5 said they had a changing places toilet, meaning more than half didn't. They include Milton Keynes University Hospital, Bedford Hospital and Kettering General Hospital. Changing places toilets are expensive to install, but campaigners argue the cost of missed appointments and issues like back problems from lifting cost the NHS more.
It is really sad that our healthcare professions don't understand that this is a vital resource and it's impossible to go out without it.
The hospitals which don't have a changing places toilet, like Peterborough City Hospital, said it was due to a lack of space and that it's something they're considering in the future. A Department of Health and Social Care spokesperson said NHS organisations are responsible for ensuring the right facilities are available. Meanwhile, parents like Natalie will continue to fight for her child's dignity. Rebecca Howarth, ITV News, Peterborough.